Our next speaker is Lourdes Inoa Monegro. She's a program director at Salud in Puerto Rico. Her talk will be focused on the integrative work of Salud. They work with individuals and community at the national level and are involved in advocacy research and also activism. So take it away, Lourdes.
Thank you, Laura. I'll do my best to share my screen. Hello, everyone. Thank you for being here today. Let's see. I'm very grateful for this opportunity. And I also wanted to share with you that I will do my best managing my English, but sometimes maybe some Spanish and some Spanglish may come up. Well, as Laura said in her introduction, I'm also living in Puerto Rico out of this moment, and I just wanted to contextualize where we are at. And I'm speaking from a Dominican and Puerto Rican background. And as Salud, Women and Health Program Director, we serve a population based in the East Coast of Puerto Rico, mostly the East Coast. Salud is a feminist grassroots organization. Was founded in 1979, focused on enhancing women's access to healthcare, especially sexual and reproductive rights, reducing violence in community settings, and fostering economic development opportunities available for women in Puerto Rico. Our mantra is that a people's health begins with the health of its women. We are profoundly committed to it, and we believe it as a truth that we want to share. As Laura also said, I wanted to focus this exchange with you in a more multi-level address on how we see the eradication of gender violence. So I would like to start with a social and political overview of Puerto Rico. In the past years, we have been surviving crisis after crisis, environmental crisis and political crisis, such as the pass of two major and catastrophic hurricanes to our area, earthquakes, and also just corruption and lack of governance is predominantly in our area. The mainstream narrative in the past 3 to 4 years has been that disasters are natural. And we want to challenge that narrative. We believe that disasters are a response for the political and power structures that are in place in a society. They're not only a natural event that causes them. We also have a lack of reliable data. Austerity policies that have been in place with a fiscal oversight board appointed by President Barack Obama to ensure the payment of Puerto Rico's debt since July 2016. The absence of citizen participation and citizenship exercise in the island, increased reprehensive legislation and the use of policy to control and criminalize demonstrations, public demonstrations. The lack of analysis of focus on people and women, at least from an intersectional approach, that is one of our approaches, and an exponential negative impact on Black, poor, immigrant, young, trans, and gender non-conforming groups. And this COVID-19 reality has hit us since the past year, the primacy of the biomedical approach relating to the COVID-19 public health response. So we want to challenge this scenario by addressing gender violence through a more comprehensive and holistic approach and a social justice stance. We believe that we create spaces and transformation for women grounded in connection and individual and collective healing are encouraged regarding violence and trauma. Women are engaged in a space that fosters and dignifies a life free of violence, where violence does not define them. Violence is not the only thing they are about, and is that not the only thing that they want to heal or pursue, where their full potential is encouraged. And we believe radically that women are agents of change. We also work with cultural identity, right? The way the community accepts the eradication of violence against women. If it's a public matter that deserves a collective dialogue, that deserves change of beliefs and attitudes and concrete actions towards it. Acknowledgement of the intergenerational effects of gender violence. But this acknowledgement comes with an analysis of systematic oppression by the mainstream groups and internalized oppressions within our communities, how these power structures have an impact in the diverse population in the island. And we work a lot around this past 2 to 3 years to address institutionalized racism and colonial policies being pushed on us, let's say. Also by integrating a gender equity in a more decolonial framework to this issue, to address the austerity measures and this disaster narrative, and to also address the trauma-informed services that we provide. We believe that gender violence is not an individualistic, meet the survivor's needs, let's say, response. It demands an uprooting of its causes and disrupting the dominant discourses surrounding patriarchal and colonial values in our society. So we see it more as a continuum of response and an interdisciplinary approach. I would like to say that this is a multi-level feminist leadership response and intersections, right? In the sense of the direct attentions to survivors of violence, we are grounded in this trauma-informed and more of a culturally specific model in a social justice and emancipatory practice, and claiming the social determinants of health to be integrated in this issue and not fragmentize the way that we can provide the service. We try to be committed to the comprehensive and holistic health approach. We also think and practice that reclaiming art, joy, pleasures, and body autonomy is a fundamental part of our exercising our right to live free of violence and our right to exist as women. And doing this also by claiming the more Caribbean, Latin American approach in these services, using a methodology of popular education in all our groups and all our way of maintaining this continuous dialogues within the communities. A second level of this response, we try to frame our surrounding engagement and organizing. Right? The exercise is exercising public participation as an act of resistance, un acto de resistencia caribeña, and calling in non-gender violence related organizations and institutions to be part of this work and to be also accountable for what is happening in the country. And by doing that, we're building up a more diverse and ongoing movement, constantly mutating our strategies and our ways of addressing this issue. And third, and not least, claiming space, right? Claiming national response to survivors and to uplift women voices and ways of living in the island. In the sense of public policy and state of emergency, as a movement, we have articulated an island-wide response for addressing gender violence in Puerto Rico. It's a drastic response, but we have seen it as a necessary response and also temporary. We have claimed for a state of emergency regarding gender violence with 4 main targets. Addressing system failures, and as you can see, that includes allocating resources to guarantee the provisions of services to victims, the investigation, evaluation of the failures in the integrated response, and proper monitoring of agencies' efficiencies, specialized training to health, justice, and criminal system personnel, and an assessment of the re-education programs for offenders. Second, we have a burden, as we say in Spanish, una deuda pendiente with women surrounding sexual assault survivors. So the issue of accountability is a top priority for us, and sexual assault survivors should be also a top priority. We have more than 2,000 safe kits that have not been processed since 2004. So this issue has been in the center of the demands on a state of emergency. Third, a public discourse towards gender violence, where service providers and social justice activists must have a guaranteed seat at the decision-making spaces. And this include all women, self-identified women, trans women. We want a gender perspective in all policy analysis and its specific implementation in public education and curricular. I think this has been an opportunity for us to share an overview of what is happening in Puerto Rico right now regarding this issue. And I am more than grateful to be with you in the next hour to share other thoughts and just break down a little bit more on how we do it and why we do it this way and what are the results of this path that we have taken. Thank you all for your time.
Thank you so much, Lourdes. I'm always proud to walk and march alongside Taller Salud during protests and marches that are constantly taking place in the fight against gender violence in our island. Does anyone else want to have a chance to answer the question about major barriers?
I would like to say yes. Does everyone hear me?
Yes.
Yes, I also wanted to say that regarding intergenerational trauma, there's a pretty psychological or individualistic point of view. And just adding to the words of Nataly and Sonya, that we need to a bigger table, let's say, to do this analysis and just to put our best efforts forward in a more interdisciplinary approach to these problems and to this systems barrier. And that comes from everyone that is doing this work, everyone that is trying to eradicate violence against women, seeing it in a multi-level way of working, not only responding to survivor needs. I think that's a message that we want to put out there. It's not a single person issue, or it's a healing people issue only. Healing is a political act, and that is at least that's where we come from. Because what we need to heal has not been it has been our burden to carry, and it has been a societal burden to carry. I just wanted to say that.
Okay. So my closing question would be, most of our audience, because our network of species is mostly made of psychologists. So my closing question to all of you would be, what do organizations such as SPSSI and other psychological organizations can do to support organizations or your work as panelists and in the UN and as FreeFrom and Salud? Anyone?
Yes, moving forward towards community, right? Moving forward, learning outside the academic circles and the spaces that are typically what give you the authority to be a mental health practitioner. I think we need to listen more what is happening on the ground, how the women and people are assessing their mental health and how they want to engage in other ways of living, but not from a point of view of persisting judgment from any provider or any people that is available to them in a moment of crisis or in need. I think at least for us here in Puerto Rico, there's still a lot of taboos and myths surrounding mental health awareness. And I think more practitioners are needed to have a tool set, a more emancipatory work tool set on hand to work with them. I think, yes, in that line.
So we are out of time. And I want to thank you all for being here. Thank you all for such a great and compelling conversation and discussion. And I hope this was a space for everyone where they could learn about different perspectives in how to address and how to eliminate the intergenerational transmission of trauma, of gender-based violence, sorry.